Greater Trochanteric Pain Syndrome or gluteal tendinopathy can be a real pain in the butt. Well, maybe not quite in the butt, more like the outside of the hip, but it's a super common condition I see in my sports med clinic where we have this outside hip pain. And if you've had it, you know it can be very, very annoying. It can also be challenging to rehab. So today I'm going to talk through my entire process of how I think about rehabbing this condition, kind of giving a template to follow and just kind of a general formula of how we think about rehabbing any condition really, but specifically for this lateral hip pain. So let's dive in and get started. So I did create this kind of cheat sheet for me just so I could have talking points. This will be linked below in the description. And essentially we're talking about Greater Trochanteric Pain Syndrome, how to get better and understanding it. So first things first, this is not going to be a diagnosis lecture. I have a much longer video about Greater Trochanteric Pain Syndrome, and I'll link to it here in the show notes and also in the YouTube video. But overall, this is that pain you have on the outside of your hip. A lot of times people think it's bursitis, and we've kind of moved past that. We think it's more of this tendinopathy of the glute tendon, specifically the glute med, glute minimus. And when we have this tendinopathy, we have to treat it like a tendinopathy. The old answer used to be just do steroids, and that gets better for a little bit, but not long-term. So we really have to think about loading these tendons. But the first thing is we kind of have to offload it a little bit. So understanding that when are they painful? Well, it hurts when you lay on it, when you are sitting for long periods, or if you have your legs crossed, if you're going upstairs, if you're walking for a long time. Those are all reasons we may have pain. And so I kind of think about throughout this entire rehab process, kind of having these golden rules. So how do we avoid irritation? So first things first, avoiding compressive and irritating positions. So specifically, if you are sleeping on your painful side, don't do that. Don't lay on that side. A lot of times tendons specifically don't like compressive loads, and compressive means when we push on them. So tendons don't necessarily like that, whether that's the Achilles or here in the greater trochanter, they don't like that. So when you cross your legs across your body specifically, that is also another compressive load. So laying on it directly or pushing on it doesn't feel good. If you cross your body while sleeping, meaning like you're laying and your legs are kind of crossed, that can irritate you. Those are things we want to think about. So avoid it if possible. If you do lay on the opposite side, put some pillows between your knees to keep your hips nice and level so our legs aren't going in. When your hip goes in towards the middle of your body, it's called adduction or adduction. That can compress the tendon as well. So big things are try to not sleep on that painful side. And if you sleep on the other side, try to keep some pillows between your knees to keep your hips kind of neutral, or maybe just on your back with something between your leg. Find something that's comfortable, but not on that side. That would be very helpful. From a sitting perspective, don't cross your legs. People love crossing that. But once again, when we cross that body, we're doing that adduction. That can really compress on that tendon. Doesn't feel good. So try to avoid crossing your legs. And don't try to sit too deep. If your knees are higher than your hips, try to avoid that because that can lead to compression as well. So those are the big things. Get up and move around. That's very helpful as well. Don't just sit there. And then standing, don't just hang on the hip. Meaning if you're hanging there and you just hang out to one side, all your weight is through that tendon, that might irritate you as well. These are all like recommendations, right? Nothing I'm going to tell you today, nothing I tell you at all is like, you have to follow. Like this is the Bible of rehab. This is just, hey, kind of my thought process through that. So take it or leave it. You can do what you want, but that can be helpful if you're not standing on one side. And then stretching. This is a big one. Everyone loves doing essentially pigeon pose, right? Your leg is across your body or your figure eight, whatever you want to call it, where your leg is across your body. That's not going to be good long-term for that healing, just because it's once again going to bring that compressive load onto the greater trochanter over on the outside of the hip. So avoid that for a little bit. I know it feels good for a little bit, feels good for a second, but it's not helping long-term. So avoid those cross body positions. So these kind of go all throughout the entire rehab principle. If you're having flares, really remember to go back to the golden rules. And then next I have the stoplight approach. So a stoplight approach, the way I explain this is that this gives you a target for when you're doing exercises or any sort of activity, whether it's okay or not. So I'm not saying any specific activity is good or bad, but it kind of gives you some guidelines. There's green light, yellow light, red light. Green light is if your pain is 0 to 3 out of 10. And when I mean where your pain is, it's either during the activity or up through the next 24 hours. So we're looking for a full day. If you feel good while you're doing it, but the next day you're really sore, that might have been a little too much. And so something to think about. Green light is 0 to 3 out of 10 means, hey, good. Like you can do that and then you feel fine, continue with that, maybe increase up the next time. So no worries. Yellow is when we get into like that 4 to 6-ish range, 4 to 5, maybe kind of, it's up for debate. Doesn't matter. The idea is that it's not like, ow, take your breath away pain, but like, ooh, that's kind of sore pain. And for here, I want you to think about, okay, maybe I'll need to tweak the activity I'm doing, the amount I'm doing, something, but I don't necessarily need you to continue to stop. I just kind of probably wouldn't want to repeat that time and time and time again. But that's kind of yellow is that caution of, hey, I'm not doing damage necessarily, but it doesn't feel great. What can I tweak there? And red is like the take your breath away, like, ow, that really hurts pain. That doesn't really help in a rehab process. So we kind of want to avoid that. So that's kind of how I think about that. it's variable whether it's for yellow, it's 4 to 5 or 4 to 6. I don't really care. Whatever you use it. Just have an understanding that we don't want you just having tons of pain. But yeah, a little bit of pain during rehab is to be expected. That's another thing I'll repeat. Having a little bit of pain during a rehab process is to be expected. The goal is hopefully we take it down and then move up from there. So that's kind of how I think about all rehab. So this is the phase overview of this program specifically. You could literally just take this program and swap out and say rotator cuff or Achilles or plantar fascia because the general idea is the same. That's what I'm trying to teach is this heuristic, but this is generally what I think about. The first phase is getting you out of pain, right? So the timeline for that is 1 to 4 weeks and take a while. Using it when the hip is really irritated, flared up. And the goal here is to reduce pain, learn good habits, calm things down, and really, get there. You do these daily typically because they're just kind of bringing pain down. And the idea is that we're doing mostly isometric things here. Isometric is when you're having a contraction that is not moving. So if you think about, for this one specifically, you're gonna be sitting on the ground, you can have your knees with a band around them and then just pushing out into the band, but they're not moving. That's an isometric contraction. We find that isometrics can be very helpful for pain. They actually have an analgesic property where the analgesic means it kind of brings your pain level down. So we do these in the acute phase to kind of calm things down. And this can take 1 to 4 weeks, depending on how flared up you are. Everyone's mileage is going to vary. Then we go on to the phase 2, which is building up the strength of the tendon and the tolerance. So tendons like load. I'll say that time and time again, but they're kind of like Goldilocks. They too little load, they're not great. Too much, they get angry. We got to find that right amount of load. And as I mentioned before, they like tensile load, which means stress kind of through the tendons, but not necessarily from a pushing force. So compression forces, when they're pushing on it, they don't like that. But when they're getting pulled on and using it, that they like. So they like that. And that's kind of helps them build their adaptations and get stronger. And phase 2 is all about building up the tolerance of those tendons to get stronger. And so this can take a long time, up to 6 to 12 weeks. So quite a bit of time. And it's going to be flexible, right? So for you, maybe you've been tolerating up and feeling good. And it's been, 4 weeks, 5 weeks, and 6 weeks, you feel great. That's awesome. You can progress. Some people may need to take longer. The goal here is that you have less overall soreness and can tolerate these activities. You're going to get stronger in your hips and core and glutes and all those things. I'm doing these typically every other day or 3 times a week because, we're going to do some stuff where we're going to start getting a little harder. And I want you to kind of build up and let your body kind of have a chance of recovery. And yeah, we're doing a lot of these things. The focus of this intensity is working about a 5 or 6 out of 10 with something called the RPE. So rating perceived exertion. I want you to work hard, but not too crazy. But you should be challenged by these exercises. And it's going to take a while. And we really focus on tempo here. So tempo is 3 seconds for the concentric, 3 seconds for eccentric. What I mean by that is, let's say you're doing a squat, right? When you're going down on the squat, it's gonna be 3 seconds down. Maybe you can hold for a second at the bottom, then 3 seconds back up. It's really challenging to do anything that long, but we find that tendons really like that load. They like that tempo. So we call that heavy, slow resistance, HSR. Sometimes you hear about eccentrics, which is just the lowering. I find HSR to be a little easier because you just go down slow and back up slow. So that's kind of what we're focusing on here. But this second phase is all about building you up. And the third phase is going to be getting you back to doing the things you want to do. So whether it's hiking or running or jumping and stuff like that, just general ideas. That's once you're ready, once your body is ready for that load, then we can introduce it. I think a lot of people skip that middle part where they kind of calm it down, feels better, try to go back to what they're doing. And that's where we kind of have this irritation. Your tendons take time to get ready. So you need to slowly build things up over time. And that's what that second phase is all about. And it's really important because you're building the tolerance of the tendons. So that's the third phase, is getting you back to doing things like running and jumping. And, typically we'll do these not every day. We're going to kind of mix them around our strength. So strength 2 to 3 times a week, your specific activities 1 to 3 times a week, kind of mixing them on off days. So I wouldn't have you do the same things. But these are going to be challenging workouts. So we're going to continue to progress with our strength. With an RPE rating of perceived exertion of around 7 or 8, meaning, hey, I want you to be working hard here, and pretty darn challenging. RPE 8 means if after your end of your last set or your last rep, you should be able to do about 2-ish more, meaning, hey, I could have probably done 2 more, but that's about it. That's the general idea. The main thing I want you to think about is you have to work hard. That's what I want. I don't want this to be easy, but that's what we think about. That's kind of what it is. And once you've slowly built things up, you can get out of there and continue to go. So just we'll kind of scroll on here. As I mentioned, phase 1, the big thing is calming things down. And how do we do that? Well, the first thing is isometrics. So what I have here is isometrics are those contractions, as I mentioned before, where we're contracting without resistance. And specifically here, we're going to work on a couple different directions. So first things first is glute squeezes. So you're literally just laying on your back, squeezing your glutes. You're doing that for a little bit. To start, it's like 5 to 10 seconds, but then eventually I want you to get up to going 30 to 45 seconds. That seems to be the amount of time that it takes to kind of really start getting pain reduction improvements. So eventually you're just gonna be squeezing for 30 to 45 seconds. and performing 3 to 5 reps of those, and you have 1 to 2 sets as well. So you're going to do 2 sets goal and kind of work up to hopefully 2 or 3 sets, doing 45-second holds, doing multiple times. That's the goal. And then we have knee squeezes where you're going to be essentially laying on your back and squeezing your knees together. That's a deduction. Same idea. We're going to slowly build up. And then at the end, we have hip abduction one. So you can do this either on your back or, going into a wall, or you can do it with a band. There's a whole different ways to do this. Another thing is these are just random exercises that I just put in there. They're kind of ones that are throughout the literature in the physical therapy world, and I put them in there, but there's literally so many exercises you could plug in for any of these things. This is once again, just a general framework that I use, but I just kind of put some example exercises in. And so none of these exercises are magic. That's for sure. You could do other things and they may or may not work for you, but this is just once again, a general idea of how I think about this. And so that's really our phase 1. We are trying to just initially calm things down, moving on and going up from there. So then phase 2, when they say, when am I ready for phase 2? When your pain is considerably better, right? We're kind of chilling out more in that 0 to 3, and that's daily stuff, just kind of existing. I'm not talking about going upstairs or running or doing things you want to do. That's probably still gonna be painful, but day-to-day activities, we've hopefully calmed it down there. That's what we're thinking about. And then you can comfortably do these isometrics for multiple sets, for long holds of 30 to 45 seconds. And you feel good with the golden rules, meaning, hey, I can kind of tolerate things here and I can understand how to titrate things and move things so I'm not feeling as bad. That's when you can move on to phase 2. And this is where we build it up again. Same things here. We're going to do this 3 times a week, general, kind of general template. You could do more. You could do every other day. You could do 4 days. Once again, nothing I'm telling you is like magic. Nothing I'm telling you is like set in stone. This is just like, hey, I tried to make this as easy as possible to follow along. Like for someone just like at home to do this, or with like a minimal exercise equipment, just you can do this. And yeah, but I just want to have that general idea. And then we had those 2. And then so strength exercises, first we'll start off with bridges. So bridges, you're laying on your ground, just lifting your hips up. This is where we start to incorporate that tempo, right? So 3 seconds up, kind of hold the top 3 seconds down, really focusing on, slow and controlled activities. And I start with body weight here, but at any time you're like, this is way too easy, then you can absolutely start adding on weight. I talk about different progressions as well, but we're going to kind of start off building up, right? So we start 2 sets of 8 to 10 reps, hopefully getting up to 3-ish sets, 15 to 20 reps. That's what it is. And then we have banded walks. We're essentially working on our outer hip musculature when we're walking with a resistance band around our legs, really slow walks. Once again, everything's slow because it just makes it harder. That's like my way of tricking people. If you go slow, it's really challenging and you don't think about like the weight you're doing. Some people who are really, really strong, if they're doing a slow tempo, it's completely different and they don't worry about, the weight they lifted. If you tell someone who loves lifting a specific weight and then you say, hey, I want you to do like 75% of that weight at the same speed, they're gonna be like, I don't feel good, or like, I want to lift more. But if you just completely slow down the tempo, it's like an entirely different lift. So you have to figure out like what is their normal for them, and it's very challenging. So that's why I like tempo. But yeah, I do some banded walks here, and then we can add in specific abduction exercises, working the outside muscles. So you can either do standing or side lying with bands. It's totally up to you. It doesn't matter. Once again, all these are arbitrary. And yeah, that's kind of the general idea. And then mini squats. We start to introduce squats. Usually we start a little slow to start. We're not going all the way down. I think we kind of work our way back up as well. Yeah. So that's kind of how I think about these squats, and it's just a general strength, right? These are general strength, and you might be able to progress fast. If you're a high level athlete, like that's probably not gonna be enough. You're probably gonna have to use load on the bar. So you're gonna have, let's say you squat 315, maybe you're only gonna be able to do 135 with a plate. Like it's one of those things where we just gotta calm it down, find where it doesn't feel bad, follow the pain rules, and then slowly build from there. That's the general idea of this entire section. And so nothing's magic. How do we progress to phase 3, is when we're hitting these goal tempos, reps, sets, feeling challenge as well, but really feeling pretty darn good. And our day-to-day is not too bad. That's when we can kind of move on there. And yeah, overall, those are big things. And then phase 3, this is when we start to get into some jumping plyometrics. This is kind of actually optional, depends on your life, right? If you're just like, hey, I just hang out in the gym and I do some lifting and I do some cardio that's not bothered, my hip doesn't bother me, like, then you don't necessarily have to do this. But if you're like, hey, I'm an athlete or I'm a runner, I want to get back to it, then it's probably a good idea to introduce some of those more ballistic and jumping things in a controlled environment first. And so, yeah, we're going to continue on to get strong, and then we'll add in things as well. So once again, I keep going with bridges because I think bridges are helpful for the glutes. You can do hip thrusts. You can do so many different things. You can do stagger stance. You can do single leg. You can add on weights on the bar, put a bar across your hip. You can do bands. There's so many things. Once again, I just want to throw this out there that you can do that. And I'm just kind of giving you a general idea of what you could follow. And yeah, and then we have banded walks for longer. I think it make it more challenging. I just like those. I think they're light. They're, not too stressful, but they're really, really good. Then I start throwing in some hamstring curls just to kind of round things out to make sure we're getting the whole lower body and posterior chain. And then squats, we're kind of progressing them as well. Add weight, whether it's you're going to do goblet, front squat, back squat. You can do single leg squats. There's just so many squats. But we're just, once again, just trying to build up tolerance through those tendons. And so we're tolerating it. And then after there, a couple of activity specific things we can do, 1 or 2 times a week. In terms of, you could run maybe once a week, kind of start off with run walk intervals. So you're going to run for 1 minute, walk for anywhere from honestly, it could be 10 minutes or 9 minutes. You do a 1 to 9 ratio or 10% ratio and then go from there. That's a whole different discussion, whole different topic of returning to run. But I just want you to think of, hey, if you're doing this, start to run very, very gently. Maybe do 5 minutes or a minute. And then the next time you try and you were good and it's in the green, you can do 2 minutes or 6 minutes, whatever you started with, just very, very, very slowly incrementally go up. That's going to think about. Don't jump it too fast. And then our plyometrics, we can do them. It's hops in place. So you're hopping up and down, forward and back, side to side, or kind of doing drops as well. So you're stepping off a low box or of a bench or anything like that. And that's kind of what I think about. And that's the thing. And at any time at the end here, it says pain relief holds. Anytime you're flared up, you can always do isometrics. Sometimes you have bad days and you have flares, and isometrics make you feel better. Totally reasonable to do that as well. The main idea is that we're getting better over time. I tell people recovery is kind of like the stock market. Maybe don't listen to whatever is happening in this current time when you're listening to this, but the stock market in general goes up over time. But there's good days and there's bad days. But that trend line is really what's important. And that's what I say I care about to my athletes, is that I care about the trend lines. So over time, are we getting better? I usually draw a graph too. So on the y-axis is pain, on the x-axis is time. And as long as it's like this slope going down. So for my audio listeners, we're saying a slope going down from upper left to down right. As long as that slope's going down, meaning that pain's getting better, that's all I really care about. And some people that is quick, some people that's not. And that's okay. It's going to be variable, but this is just a general idea. And then we're kind of getting back to full activity if at all possible. And the big things here is you got to be patient and consistent, right? This is going to take time. It's going to take effort. And this is not a no pain, no gain, meaning, hey, I'm going to push through. No, listen to your body and adjust and pull things back as needed. Don't push through flare-ups. We'll work around them and kind of get better. Focus really on the form and tempo. And remember to breathe. Don't just hold your breath during exercises. And this is really just the starting point. This is the start of everything, and it may not fix it for you. That's the thing too. This template, there's no guarantee it's going to do anything for you necessarily. Sometimes people follow things, a decently well-structured program, and they don't get better. And sometimes they need just more either hands-on or some tweaks. And that's where a generic program that anybody gives you will never be the answer. This program will not be the answer for a probably decent amount of people, because that's just how our bodies work. Will it work for some people? Absolutely. Because sometimes your body just needs a little bit of something to guide you in the right direction. It didn't work for them, but it won't work for everybody. And that's okay. That's how it goes. I don't want you to get entirely frustrated saying, hey, this didn't work for me. That's it. This just wasn't the right fit for you. I always kind of say rehab's like dating. You got to find that right person. Maybe first program or first therapist you try, it wasn't quite right for you, but then you find that right fit, and that's awesome. And that's magic. But sometimes it takes a couple times to do that. So don't want you to get discouraged, but overall, this is my idea of how to rehab the outside of the hip, this greater trochanteric pain syndrome. Once again, you can replace all these exercises with other things. I just want to give examples of how I think about structuring a rehab program and getting back there, just because, sometimes it's hard to if you're not in that all the time and you don't see it, it's hard to kind of understand and learn what that is. And if you're going through this and still a little confused and saying, I'm not quite sure what to do, this program is for purchase online. If you go into the description below, I'll have a link for it there. You can pick it up there if you want. If not, I talked to you through the entire thing. You pretty much saw it and you can do it yourself. But if you do want a more structured way, it is available for purchase. But thank you so much for stopping by. I really appreciate it. It means the world to me. If you like this, it would mean the world also if you shared with a friend, or if you liked it or commented on it. It just, any interaction is really, really helpful to me and means a lot. But thanks for stopping by. I really appreciate it. Now get off your phone, get outside, have a great rest of your day. We'll see you next time.